you ask me what is the cause for cancer, more than 90% of the cancers are sporadic, in the sense like they do occur without any particular reason.
What we also hear these days is that a kid who was 5 or 7 year old died out of cancer as well. Why do these happen then?
There's no way you can know why they have got, because
is working out also a way in which you can, decrease the risk of cancer in your body?
Yeah, definitely.
But there's a very big conspiracy theory which people keep talking about, the fact that in the world there is a cure for cancer already, but the medical fraternity is keeping it away because... Welcome back to Game Room. My name is Naveen Tiwari, and today we have Dr. Suman Kumar with us. Dr. Suman is one of the radiologists basically, and so Dr. Suman, I'll give you the stage and then let you introduce yourself, because I believe that you will be able to do a better justice to this.
Yeah, hi, I'm Dr. Suman Kumar, and I'm a radiologist by profession. I'm a doctor, and after that I have pursued my radio diagnosis degree, and then I did my fellowship in cancer imaging in Tata Memorial Hospital, and then thereafter I joined as a consultant in Tata, where I have been for 10 years, last 10 years.
Okay.
So the cancer imaging is a separate branch in itself. So I specifically image cancer people and diagnose and then plan the treatment. So this is where cancer imaging differs from the routine radio diagnosis.
Okay. So where does your work come into the picture? When does it start and when does it end?
So as soon as the patient comes in, the doctor sees the patient, and then he says, okay, this patient has a probability of a cancer. Then we'll get a test done, either a ultrasonography or a CT scan or an MRI, and based on the region of the interest. And then once the scan is done, I look at the scan, then say ki there is a tumor or there is a no tumor, and if there is a tumor, then what is the size of the tumor, what is the extent of the tumor, whether he is operable or not. So cancer treatment, there are 3 stages in cancer treatment. There is a surgery, there is a medical chemotherapy, and there is a radiation oncology which treats with the radiation. So I tell them this is the stage where you can operate it upfront, or this is not operable upfront. You have to decrease the size with the chemotherapy, which is called neoadjuvant chemotherapy. And then once the chemotherapy is given, you repeat the scan again to see what was the response, and then the surgery is done, and then afterwards the patient will go for either a chemotherapy or a radiotherapy. So this is how the flow goes.
Okay. So Dr. Suman, would love to understand a little bit more about your background, your personal life. Where do you come from, and how did you manage to get into this field? Did you have an interest since the beginning, or you were just a sharp kid who just studied and cracked exams and then became a doctor?
So I'm from a humble background. My father is a farmer. Still he does farming, and he has his farm at my village.
Where's your village?
In near Hyderabad, 140 kilometers from Hyderabad.
Okay.
And we have rice paddy fields where we go on summers. And my parents or I don't have any medical background. So as you know, people from small town, they always dream of having their kids as engineers or doctors.
Yeah.
So I was, as soon as I started studying and then doing well in my class 7th or 10th, then my father decided you will become a doctor. So there was no choice that whether I wanted to become or not. Then finally it found out, it became fruitful. I did my MBBS in Karnataka, then did my PG in Tamil Nadu. Then I came down here. By chance, I have come to Mumbai. It was never planned journey, but I always have this, that Tata Memorial is one of the pioneer institutes in India.
Yeah.
So I just wanted to be there for a short time, even to have a label that I have worked in Tata Memorial Center.
Yeah.
And then I applied for a fellowship there. I got it. I did 2 years of fellowship, and then the work was wonderful. The satisfaction you get of working in Tata is beyond comparison. So the salary is as compared to anywhere outside in the private setup. Being a government setup, you will have a limited salary, but still the work is amazing. So I joined as a consultant and continued my journey so far till last month I was there. but due to some personal reasons, I had to resign and start my own practice.
Okay. So Dr. Suman, I always have a very high level of respect for doctors, specifically because of the fact that the duration of their studies itself is quite long, right? I mean, I did my BCom and MBA, I finished in 5 years, and your MBBS itself goes on for
5.5 years.
Yeah, and so the before you start earning, I mean, and if you come from a humble background, it is an it is an expensive field of education. So what what drives you people? I mean, so right from the so you mentioned that you come from a humble. Do you have siblings also?
Siblings.
Okay. And I'm assuming that while you are growing up from a small state, I mean, obviously everybody keeps thinking that pehli job kab lag jayegi, and then when you start earning, you can stand up on your feet, etc., etc.
Yeah.
So how did you find that rigor of constantly finishing those studies and then pursuing this field itself?
It's a difficult, long journey. Once you are in, then as long as you're in college, you have this college vibes, you enjoy your camaraderie, and then finish it. Then once you come out, then you will know the reality that the life is not so happy as in college. And once you have finished your MBBS, the society looks upon you as a doctor with knowledge where you can treat everything. But without a PG, again, you are nowhere.
Yeah.
So either you have to start a practice as a general practice and then build up your practice over a period of time. But the professional satisfaction is very low, at least in India. If at all, if you go to UK or US, GPs are very well respected. But in India, they are, at least in towns, it's a very difficult job. So again, for PG, it's a 3 years work.
Yeah.
Then during PG also, the amount of stipend you get is very less.
Exactly.
So if at all, if there is no parental support, it will be very difficult to actually continue on this journey.
Yeah.
So I have seen my father struggle to pay my college fees and then manage my personal expenses. But that's a journey, the difficult journey. But once you come out, then it's a happy ending.
At what age did you start making any money, and what was your first income? I mean, if you remember.
When I was doing my PG, the monthly salary was 10,000 rupees.
Which year was this?
That was in 2009.
Okay. Wow. Okay. And what was your age at that point in time?
It was 35.
You were 35? Wow. And so then it requires a lot of grit, right? I mean, at 35 when you are making 10K, then उसके बाद आपके आसपास सोसाइटी में कुछ ऐसे बैंकर्स होंगे या फिर उसके बाद कोई और इंजीनियर्स होंगे who are 26, 28. आजकल तो स्टार्टअप फाउंडर्स हैं जो 19 ईयर या 20 ईयर की एज में करोड़ों कमाना चालू कर देते हैं. Then I mean, don't you ever feel that यार मतलब let's get rid of all this and then get into a proper job which can pay me slightly better.
So if at all, if you see, I mean, I'm a radiologist, so as soon as I finish my PG, I can start earning. Like the job is good, or you can start your own setup with a basic ultrasound machine and you can earn more than 1 lakh per month. If you see the surgeons, cancer surgeons journey, they have to do their post-graduation and afterwards they have to do MCH, which is again 3 years plus 1 year bond, and then by the time they settle, at least 40 years. They'll be, by the time they settle, they are 40 years of age.
Wow. Okay.
So it's a journey, but it's a, what to say, that you have to take that chance, or you have to accept that as a.
Sure. Fair enough. So, what are the pros and cons of being a doctor? Because the society also has been supremely harsh as well as supremely thankful of doctors.
Yeah.
But according to you, what is it that has been a blessing, and what is it which has still been a struggle for you?
Most important thing is respect. As soon as you say you're a doctor, the way the opposite person behaves with you is completely different. So even though you don't look the part or not, but if you say you're a doctor, then they respect you. So the respect still there in India, there is a certain kind of respect towards doctors. And the negative point is like you are expected to behave as a doctor in a particular kind of way. Like if at all, if you are going partying like a regular guy, then you are frowned upon, saying that अरे doctor है ऐसे कैसे कर सकता है.
Yeah.
So that is there, that you have to stick to the social norms.
Sure.
That is there, and then the time lag for the earning, and from the time you start your journey, and then by the time you take home the good pay, it takes a lot of time. So incubation period is long.
Sure. Doctor, I've also wanted to, I've always wondered so I also come from a place named Bilaspur, which is a small town in Chhattisgarh. Now, what I've seen is that the kind of doctors who are there, and usually what I've seen is in the medical fraternity especially, sometimes it's, you can either you deserve to be a doctor because you have studied well, or you can pay your way through also to become a doctor.
Yeah.
So according to you, do you feel that the education system which is in India, which is getting these doctors, creating these doctors itself is quite, has it evolved, or there is still scope of improvement?
See, there still the doctor-patient ratio is very low in India. If at all, if you compare the number of doctors and for the number of people, it is very low and abnormally skewed. The maximum number of doctors lives in the metros and cities and towns.
Yeah.
So the villages and the two-tier towns have very less number of doctors, and so the if at all, if you want equal distribution of doctors in the city, in the country, then you have to, the government or the society has to prepare the cities also ready for that. If at all, if I want to go to my hometown and stay, I'll think about my children's education.
Yeah.
I'll see the quality of life there. And if at all, if they are not there, then obviously I would not want to go there. So this is how the migration is happening from, the reverse migration is happening from towns to cities.
Yeah.
So the society, the towns, cities has to be ready for these kind of things.
Sure.
And then the modern education, like you said, that capital fees is there. The private colleges are good, but there is a lack of infrastructure or patient load where they can be sufficiently educated. But still, even if at all, if I say I have the money to buy 1 crore rupees, I have the money, I will buy a postgraduate degree. What will I do? In the sense, like if I have a degree, but I don't have the knowledge to practice, there's no way I can succeed in my life. So irrespective whether they get a government seat or a professional, paid seat also, until unless you acquire that knowledge, you will not be able to be successful because that is your bread and butter.
Yeah. So, but I've seen there's still, major mistakes. So, for example, there's this person in our who stays in our society. He used to live in a tier 2, tier 3 town, and he was administered with a wrong medicine by a doctor, and because of which he got a heart attack and he lost one of his, one side of his body because he got paralyzed. And we keep hearing of these instances happening, especially in tier 2, tier 3 towns. I'm not talking about the tier 1 cities. And the access to good doctors itself is quite less.
Yeah, agree. There are people who, for example, if I'm not sufficiently knowledgeable enough to treat one particular kind of disease, I obviously say, see, I don't do these kind of things. Please go to the so-and-so doctor. But there are people who say, okay, the patient has come, let me charge him and do treatment, whatever, and then once the patient worsens, then they refer it to the next center. So that happens. Either you are honest as a human being, or irrespective of whether you're a doctor, engineer, or anything, you are honest or dishonest.
And you spoke about this doctor to citizen ratio. Do you have a comparable that in developed countries, or in countries which are far more advanced there, what is the kind of ratio which is there versus what is there in India?
Maybe in UK it's around 1:100. 1:1000 could be, or here it will be like 1:10,000.
Wow. Okay.
So
All
the
right.
Indian population and the urban-rural divide is very huge.
Okay. All right. So one doctor for every 10,000 citizens.
Maybe, I mean, more than that also, I think.
Okay. All right.
But if at all, if you say this 10,000 people, if they are in the city, in the Mumbai, you would have so many number of
Yeah.
doctors. But if at all, if you go to the interiors, it would be more than that, 50,000 or 1 lakh people, one doctor.
Oh,
will be there.
wow. How can we improve this?
Like I said, that if at all, many of my friends who have done MBBS with me, they have migrated to UK or US, and now they desperately want to come back. But what is it they come back to? They say, see, the kind of lifestyle we have, they have very good health support, education support. Everything is free in UK. NHS, that is free. The education for the children up till 10th class is free, and then they have good roads and then good civic sense.
Yeah.
Now, if I go back to my hometown, there is no traffic, there is no road, there is no water, proper municipality connection is not there, and no schooling. The schooling is one of the biggest issue.
Yeah.
People will come back, okay, say they don't want malls or theaters or anything. If they want a clean cities, clean towns with a good proper education and good infrastructure.
Sure.
I mean, that is where the government is lacking, in the sense like they are trying to concentrate, build a primary health center in a village. There is a huge building. The doctors are not able, they are not able to attract the talent because the salary they pay is 50,000 or 60,000 per month. So they obviously would not want to work in such a place. And even if they work also, they will not be able to do justice. And most of the people who work in government hospitals, half the time, they work outside in a private to earn the income.
Yeah.
You cannot ask a person who has done 10 years of his life and then say 50,000 you subsidize, you have your family life with 50,000 rupees. It's very difficult.
Correct.
So the pay gap is huge. If at all, if I say my salary is 1 to 2 lakhs in Tata, the same amount of work will fetch you at least 10 lakhs in outside.
Wow.
So, but still, I mean, I have worked in 10 years just because the work satisfaction is so good that you don't want to leave that one. But you cannot live on, what do you say, that prayers only.
Yeah.
You need to earn money.
Correct. So now getting to your area of specialization, so the two most and dangerous, the two most fearsome things which is picking up pace, unfortunately, in terms of people getting, people suffering from it is cancer and heart attack, right? These are the two most prevalent diseases which is picking up a pace, along with obviously mental health as well. So I mean, as far as cancer is concerned, I mean, so you must have seen how many patients by now? I mean, cancer patients.
I say, see, in Tata, it's like 50,000 people register every year, new patients.
Oh.
So imagine for 10 years, it will be like 5 lakh people or something. So in Tata radiology department, average of 200 to 50 people come for the scanning.
Every day?
Per day, every day.
Every day, 200 to 250 patients.
So you say, if at all, if I say CT scan, it will be like 150 people get a CT scan done.
Yeah.
MRI, 50 people will get. Ultrasound, maybe 100 or more than that one. So combined, you'll have 250 to 300 people per day getting either of these scans done.
Has this increased over a period of time, or when you had started 10 years back, was the intensity this high?
Now I would say the awareness is increasing. So people, and then affordability has increased.
Yeah.
And then people previously used to give up and then let the cancer take its course.
Yeah.
But now people are trying to get a treatment for that. That's why the numbers have increased. Not because the cancer rate is increasing. Cancer rate is obviously increasing. The population is increasing. Obviously, then the ratio will increase, and then number of people who are getting access to the treatment is increasing. Affordability is also there. So that's why the numbers are increasing.
Sure. So what do you think? Is the reason for this rising cases of cancer coming up, or was it always there but awareness was not there, or it's actually increased in number as well?
Definitely, it's increasing. Like you say, 10 years back, in women, cervical cancer was the most common cancer in India, because that was because of the urban-rural divide. So the the standard of living was poor. The cervical cancer was more in women. Now, with the increasing urbanization, the breast cancer has become the most common cancer in women now.
Okay.
So it has overtaken cervical cancer. So because the standard of living has improved, the hygiene has improved, so cervical cancer has gone down with the vaccines, everything. But because of urbanization, increased women taking up the jobs, increased stress, and urban lifestyles have increased breast cancer rates in India is at par with what we are seeing in the Western population.
Sure. So, and there's a lot of, myths or for that matter, realities or perceptions around why does a person get a cancer, right? What I have seen a lot is that, so for example, there are a couple of colleagues of ours who had cancer in their family earlier. And usually so the perception is that if you have it in your family, then there is a very high possibility of you getting it as well. So genetics play a very important role. I'm talking purely as a layman from outsider.
Definitely.
Second, people speak about lifestyle. If you are a smoker or you drink a lot, then you have the possibility. Then you have the possibility of getting cancer. These are the two most common things which we hear about from a cancer standpoint.
Yeah.
What do you think amongst these? Which are the top three causes of somebody increasing the risk of cancer in the body?
Like you said, lifestyle is one of the most important factor, and then genetics do play a role, in the sense for that particular family, genetics is the most important thing. The person, if at all, if there is a person who is afflicted by cancer, but at the age of 50 or below, so younger age group, if at all, if the person contracts a cancer, then the chances that his offsprings or siblings might get a cancer is high. So the hereditary risk is particularly high for particular family.
Okay.
And then in different cancer, for example, breast cancer, colon cancer, liver cancer, there are genetics which play a major role, but other cancers, they are different. So, but if at all, if you take overall, it's like the risk of cancer is genetically transmitted is only 10%.
Oh, is it? Okay.
And then more than 90% of the cancers are sporadic, in the sense like they do occur without any particular reason. And if at all, if you ask me what is the cause for cancer, I don't know. Nobody knows. This is the state of life, state of science in the present day scenario, where nobody in the Nobel winning scientists also cannot say, okay, I'll tell you this is the cause of cancer, you remove this, the cancer will not come. Nobody knows that. So this is the aggregate of factors, like multiple factors coming into play. And then different factors have different intensity. Like you say, smoking, why not 100% of the smokers get cancer? Only few get. So the smoking increases the risk of cancer, but it will not definitely cause cancer.
Okay.
So the person also should be vulnerable. Along with that, for example, smoking along with alcohol maybe increases the risk more. Smoking along with alcohol, with obesity, and with increased stress. So the chances increases. So only we can say that there is a particular cause which can increase there is an increased chance or decreased chance. Probability only we can say, but we can never say that 100% this is going to cause cancer.
Okay, all right. So and how much? So when you spoke about lifestyle, what are the key indicators which one needs to keep in mind if in case we have to avoid the risk of getting cancer?
Lifestyle, I said, like in lifestyle, one of the most important factors is stress.
Achha.
So recently we had a teacher who had come for checkup of the breast with my wife. She's a breast cancer surgeon, and then there was a lump felt, and then we biopsied, it has come as positive. Then after a few days, there is another teacher. Then she was saying then the first question she asks is, what is it you do, what profession you do, and then how is your lifestyle? So being a teacher, I think is one of the most stressful job in the world.
Oh.
I have recently told one teacher also the same thing, that see, like this is example of the stress, how the stress can take it all. Teachers being teachers, they are very particular about their lifestyle, about their diet, about whatever they do. but the stress of managing children, their studies is so stressful that they are actually at risk, very risk.
Oh.
So we recently mailed to our kids' school saying that please we will want to do a screening of all the teachers at a discounted price, because we feel that the teachers are at high risk.
Wow. Okay.
So, like I said, the stress is one of the most important factors in any cancer, not only breast cancer, but any cancer, one of these. And then diet.
Okay.
Like the modern day diet, if at all, if you see 50, 60 years back, I don't think we Indians would have been eating so much rice and wheat as we are eating now.
Yeah.
So it was a, what to say, that colonial push towards having one uniform cereal rather than we used to have millets, different kinds of
Jowar and
everything, which were actually less environmentally polluting, and then they were also good for diet because of their low glycemic index. Wheat and rice, the reason why they are bad is not because they are bad, but the way we eat it. So we consume it so much in different forms that they get easily absorbed, and then they increase the insulin levels. Insulin is one of the most important factor in diabetes.
Yeah.
Where you have the pancreas has certain amount of insulin, and which we get it depleted by the age of 40, childhood obesity, everything. So that pancreas also, the pancreatic cancers also is one the reason why the pancreatic cancers is because of the diet.
Okay.
So diet, lifestyle, sleep is one of the most important factors.
Okay.
Sleep is the most neglected part, and then the most important factor. So your body, if at all, if it has gone through particular kind of stress, the way it can be reset is by sleeping.
Okay.
You see the change, the way you rejuvenate yourself after you have a sound sleep for at least 1 week, you see the change in yourself. So that automatically we know that sleep is actually helping us in repairing ourselves. So there is a hypothesis called double hit hypothesis. So in our every cell there is a chromosome, 2 chromosome double helix, every gene. So if one gene is damaged, the other gene will take care of your metabolism. But smoking, lifestyle, stress, sleep, everything, if at all, if it's going to hit the other gene, then the repair mechanism becomes faulty. And then they start abnormally reproducing the cells. So cancer is what? Abnormal production of your cells which are not under your body's control. It is not something foreign. It is your own cells which are reproducing, producing, and they are not listening to your body's command. And then they take up all your body's nutrition, and then they invade the surrounding structures. That is what is cancer.
Wow. Okay. I mean, stress mera bad gaya but listening to it. So technically, I mean, so then the doctor as a profession is most, should also be worried, right? I mean, because you guys can get emergency calls anytime. So obviously sleep gets disrupted.
Yeah.
I have a doctor friend of mine who is an intensive care specialist. So imagine forever, I mean, and unfortunately he smokes also. So, and diet is all over the place. So, so then stress-wise, sleep-wise, both these factors, doctors also are at very high risk.
Everybody who is neglecting their own health are always at risk.
Okay.
I have recently in one of the private centers in Powai, he's an anesthetist. He was 45 years of age. And then he's very good. No indication of anything, and suddenly he had one headache, said, and then he got a scan. Then there was a tumor in the brain. Within 2 months, he expired. Nothing could save him.
Just a headache, and
so it's not like the headache is the reason for the cancer.
Sure.
The cancer caused a headache, and then he got a scan done.
Oh.
So there is no way he's an anesthetist. So you don't know why. Nobody knows why.
Okay. Wow.
So even the doctors are prone, and there was a medical oncologist in Tata. She treats breast cancer, and she herself got a breast cancer, and she openly came about and discussed openly. She came out after the treatment that she has successfully completed a treatment, and then she's a fighter now.
Wow.
in our meeting also, and to help people to get that come out of that aversion about cancer. She herself has publicly announced that I have been affected with the breast cancer, and during cancer treatment also she used to come to the hospital to treat patients.
Oh, wow. Okay. So tell me, doctor, so what we also hear these days is that a kid who was 5 or 7 year old died out of cancer as well,
Yeah,
right?
yeah.
And I mean, why do these happen then? And because those guys have not seen a lifestyle or done any damage to their
Yeah.
body, and yet cancer has, they've been victim for a cancer, right?
So childhood leukemias and lymphomas are one of the most common blood cancers. They get afflicted with the blood cancers, and another one is eye cancer, retinoblastoma they call it. They retinoblastoma and then nephroblastoma. There's a cancer of kidney, and then hepatoblastoma. These are the common cancers in children. And like I said, genetics is one of the important factors. Then there's no way you can know okay why they have got, because it's just that children or some people are more vulnerable. Like I said, the genetics, in the sense they're not hereditary, but the gene is defective in them. So one particular gene gets defective, then that causes cancer.
Okay. Wow. So now that we are on this topic of children, I mean, so let's say if in case I have to grow, what we have started seeing is that the exposure of junk in kids, right?
Yeah.
At a very, very early age. I mean, we see in the airport a mom is feeding pizza, or for that matter, I mean, anything,
French fries,
cola,
burgers, yeah.
fries, everything. I mean, and I believe that those parents feel that oh उसका वो रो रहा था तो फिर उसके बाद I fulfilled a wish, but actually you're putting a wish inside the body technically. I mean, so what do as parents, what can we do to help our child not grow up and become a cancer victim?
I mean, it has to do with our advertising and marketing, one of the things, and the way the government promotes. See, I was in London in 2018. There on the London tubes, 2-3 years prior to that one, there was advertisements all over regarding burgers and then pizzas. Now the government said ban. We will not allow any advertisement in the subways because that is the government property. So we will not allow any advertisement regarding burgers or pizzas or which has fat content in it. And then they have this labeling system where it's clearly mentioned how much calories is there, how much is the junk, and how much is the nutrition value. Here we have it in a very corner where you cannot even read it. It's indecipherable. So from the government point of view, that has to be taken, where labeling has to be very clear. And then from individual point of view, I think awareness is the only thing. Now people in the villages always look at the town saying that they have this amazing lifestyle. They go to burger joints, pizza joints, and they eat, which is not available in towns. That they should be blessed with. But now this is like we copying the West and the rural copying the urban, and then that's how it's percolating. So awareness about the value. See, anything in moderation, I don't think it's wrong. For example, if you eat pizza once in a month, burger once in a month, it's fine. If you try to restrict them, then they crave for it. So instead, I would say anything, either good or bad, in a moderation, is always like the principles of Buddha. Always moderation in anything. For example, even if you are a health junkie and you try to do all things as perfect as possible, you try to be very hygienic, or you measure your calories and eat, that is also not good. It's better you balance it out. That's
all right. How much does sugar play a role in
there's so much of news in sugar. Even I am amazed at the kind of information which we have in the social media. Sugar does play a large role. Sugar, the most important thing about sugar is it causes insulin spike.
Yeah.
So your insulin is the one which is going to metabolize the sugar, and then it will also increase your fat content. So it also decreases sugar, increases the fat. And the absorbability of the sugar. The faster it gets absorbed, the faster there is a spike. So if you have a complex sugars like rice with a husk over it, or brown rice, or wheat which is not very polished, like the maida. If at all, if you decrease these things, the burgers and pizzas or these things, they get absorbed easily. They're purely maida. So you don't want the insulin spike. So the number of times there is insulin spike, it will cause stress on the body.
Okay.
And then that is what we dysregulate the metabolism.
Okay, and that can be one of the causes leading up to.
That mostly causes the lifestyle diseases like obesity, diabetes, and diabetes causes the inflammation of liver. And then even without alcoholism, no alcohol, and the person is diabetic, the chances of getting a non-alcoholic liver disease, which leads to cirrhosis, which leads to liver cancer, is very high.
Okay, understood.
So sugar is one of the pro-inflammatory. So inflammation is one of the causes for the cancer. So sugar causes inflammation in the body, and then for the inflammation, it has to get repaired. So disruption, repair, disruption, repair. This mechanism is one of the reasons for the cancers.
Okay, got it. So so let's say if in case I have to build a lifestyle wherein I can potentially avoid any kind of cancer, then what are the so you spoke about diet, you spoke about stress. Is working out also a way in which you can decrease the risk of cancer in your body?
Yeah, definitely. Exercise is one of the it becomes a healthy lifestyle not only for the cancer, for all other lifestyle diseases. Exercise is one of the most important factors. Mentally also, for it creates endorphins in your body. It's like a dopamine hit. So you get that feeling of happiness inside you. And then once the body starts working out, it uses the energy efficiently and also rejects the junk food. You try to eat when you are working out or doing any healthy exercises, the body will not accept it, and that craving for the junk food also decreases.
Okay, all right. And so you are one of those rare doctors who have seen has kept yourself very, very fit as well. And I believe that you have also done Ironman as well. So what made you look after your health and do Ironman as well?
So from college days also, I was athlete, and I was always active physically, and I was not a long distance runner, but in my school days, they used to make us run early in the morning, at least 2-3 kilometers of run, and then regular football and other athletics I have been participating. And then I have during my studies I have neglected the workout parts. So there was always in my mind, once I become a doctor, I will start my workouts. Then my children came in, then I had to give more time to family. So I kept on postponing it. But luckily my body was not in a bad shape when I started taking. And I always look at the patients. I have seen the patients who have come to the hospital, and then once they lose their health, that is when they always repent. I should have done this one. That remorse. I always had that feeling that I should not have the remorse, that I looking back at my life and I say I should have done that one. So that is one of the major driving factor, that I never wanted to say that I did not take care of my health. So that is one reason why I started my workout journey. I started my runs slowly, in the sense like the first time I did my 5 kilometers, I was exalted. That was in 2017 or something. Sure. I did my 5 kilometers, I registered for one run, and then
in how much time?
45 minutes I did 5 kilometers. Okay. So Then I understood. By looks of it, I might be looking physically fit, but when I ran 5 kilometers, I was not. And then people who were 60 years of age, they just breezed past me. 5 kilometers, and then 5 kilometers. Who does 5 kilometers? That is what their expression was. Then I thought, okay, maybe I should start working out. Then I increased my duration of running, and then I did my 10 kilometers, and then I did my Tata Mumbai marathon in 2021. And then 2020
full marathon,
half marathon.
Okay.
And then I did my best half in 2 hours 4 minutes, 21 kilometers.
Oh wow!
Tata Mumbai marathon. Then I've joined a running club in Mumbai. That's Striders. They have been instrumental in my improvement of running. So along with running, there was a group of physical workouts where strengthening your leg muscles. Everything I used to do it regularly, and then next year I finished my full marathon, 42 kilometers in 4.5 hours.
Oh.
Then I said, what next? So once the 42 kilometers is done, then I thought, okay, I'll try a triathlon. So for triathlon, you need a different set of muscles. So triathlon is swimming, running, and cycling. So I thought running will only strengthen your legs. So I wanted to have a whole physical whole body workouts. So swimming was one of the exercises which will not have any effect on your joints. So I started swimming, and the first time when I swam, it was 25 meters, and then I used to take rest. 25 meters means one lap. So one lap it started, and then it went on till 3.8 kilometers.
Oh wow!
So the Ironman swimming consisted of 3.8 kilometers, 180 kilometers of cycling, and 42 kilometers of running. So I started my swimming. I took multiple coaching classes to improve my swimming, and then finally I found my coach in Mr. Chaitanya. He is from Power Peaks. He is from Pune. So there's a chance meeting that he has conducted a swim session in Virar. It's an open water swim session. I just went there to understand, improve my swimming. Then I met him. I heard that he is a Ironman coach. Then I said, okay, fine, I'll join you. So he is from Pune, but he used to give workouts online, and then regularly monthly meetings used to be there. Then I started my cycling, and over a period of 1 year, and then I thought I'll register for a half Ironman. Half Ironman is half of all these distances.
Yeah.
So I said, I'll do half. Then the coach said, see, you're fit enough to do a full. Why don't you do a full? I said, okay, I'll register. And then I haven't told it my family, my friends, anybody. Only my wife was there who was supporting me.
Sure.
I was not sure I'll finish it. So I thought I'll at least attempt it. So maybe I'll be good for half. And then I have registered. I didn't even tell my colleagues, friends, nobody that I was attempting an Ironman, full Ironman. Then I registered for Italy. I started the proper Ironman training from February onwards, last year. And then by September, I could finish. And then in training, the maximum I did was 3 kilometers of swimming and 120 kilometers of cycling, 120 or 140 kilometers. So I never did a full Ironman in practice also. And then in September 20, I went to Italy, and then I could finish it in 15 hours.
Oh wow!
So 3.8 kilometers swimming, which was my weakest leg, is the swimming.
Okay.
I could finish it in 1 hour 25 minutes, 3.8 kilometers, then 180 kilometers of cycling, and then 42 kilometers.
Wow. Okay. So it took you. But when you started this physical journey, had you thought that you'll do Ironman, or
no,
you just happened to?
It just organically happened. Over a period of time, I wanted to better what I was doing.
Sure.
So once I did my 5 kilometers, then I thought of 10. Then once I did my 10, I thought of I'll do 121. And once I did my 21, and then I started contemplating, okay, if at all, if I can do full marathon, then maybe I will attempt a Ironman.
Wow.
So before doing this full Ironman, I have registered for there's a event called Bergman in India.
Sure.
So that's a Indian Ironman.
Sure.
So Bergman, Mysore, I have registered, and then one practice 400 meters swim, and then 10 kilometers, 20 meters cycling. That's a practice one.
Sure.
So Mysore, I went it in, I registered for it in February 2024. I went there, I couldn't swim 1 kilometer. Then somehow I gasped and then came out alive.
Okay.
And then I went in for cycling 90 kilometers. I finished my 90.
Wow.
Then 21 kilometers I had to run. And by the time they were all packing up and going.
Oh, that was the
Then-
first experience.
Yeah,
Okay.
then I couldn't finish it. I just left it halfway and then took my medal and ran away.
Oh, man.
And from February onwards, then by September, I could do this full one.
Okay.
So that was my waking up moment. Okay, now you are not in a correct place where you will be able to do full. So every day I used to call my coach. I said, "Coach, will I be able to do it, or should I change it to from full to half?" Coach said, "No problem. I'll give you a schedule. You follow this to the dot. You will do it."
Wow. Okay.
And then I should actually thank him. He was there during the final event also. We went along as a group.
Yeah.
Then from morning till evening, he was there on the track and he was cheering us up.
Oh.
And the last running was horrible because 180 kilometers
Yeah,
cycling you have done.
yeah.
And then
Your
40
legs must be sore, right?
Yeah. And then that 42 kilometers is in the city. It's a small town, Servia, in Italy. And everybody will be there on the side streets, having their lunch, dinner, and then they'll be cheering you. And then looking at the food, you will get so... and you're hungry, tired, then groggy. And after a while, I feel like giving up.
Okay.
So that's the, I did 21 kilometers. Then from 21 to 30, I was literally walking.
Oh.
Then somehow you meet many people on the way who will be cheering you up, running, limping, then crying. Then I've seen Paralympic. He was doing it on a bicycle. Amazing. Looking at them, I got so motivated. Then finally, my wife ran with me for 1 kilometer. She was on the footpath. I was on the road. She said, "Come on!" And then it was good. And then the final moment, it was like a floodgates opened. I was just literally crying once I took the medal. I just broke down.
Amazing.
And then you see the kind of struggle. It is like you cannot experience the pain which the cancer people go through. You can never say, "Okay, I understand your pain." You will never be in their shoe, and you cannot expect to be in their shoe. But this struggle almost gave me the amount of pain, resilience, the thinking when you say, "Oh, I want to give up," the thoughts behind whatever the obstacle you are seeing, it's almost similar to what they have gone through.
But so, doctor, I mean, preparing for Ironman as well as practicing your profession and then giving, time to your family, so much, how are you able to manage together then?
That's what, it takes a toll on your personal life, and professionally, you have to have that, in Tata at least you have to punch in at that particular time and come out of the time. So that time is fixed. Only thing is we can take out of our own personal time. The family had to sacrifice a bit of their personal time. And then most of the long workouts were on Saturdays and Sundays. So again, that is also gone. So once you run for 4 hours or cycle for 5 hours in the on Sundays, and then rest of the day you will be sleeping. So the family had problem. My wife always used to complain that once you start preparing for Ironman, then you forget your family. But they have been very good support. Without family support, you will never be able to do this one.
Sure. And have you transformed as a person as well? Do you see any transformation? Because one thing is physical transformation, but I believe that emotionally also you go through a journey, right?
Yeah, definitely. Physically, though, you become physically fit, and then I can see my parameters like the VO2 max going up, your oxygen carrying capacity has increased, your heart rate has decreased. My base heart rate is almost 40 to 45 always now.
Oh wow.
And then even while running also,
resting heart rate
heart rate is sometimes it goes to 38, 39 when I'm sleeping.
Oh wow.
So you know that your heart has become strong, and then your VO2 max, so your lungs have become strong. These are the two major machines of your body.
What's your VO2 max?
49.
Oh wow.
It went up to 52,
Okay.
but last 3 months it has come down to 49.
Okay.
Again, now to increase it.
Sure.
You know that, I mean, more than the muscles, it is the lungs and the heart which are the major muscles of your body which will keep you run.
Yeah.
So there is a formula, in the sense, like, I don't know how true it is, but all the major workout books say that your VO2 max keeps on falling.
Yeah.
So it will go down 10 points in 10 years. In next 10 years, it will be like 38. So if at all, if your VO2 max, you want it to be at that particular level, so you have to double it now. In the sense, like, you increase 10 points, maybe after 10 years. So what I want to is not that I don't want to grow old. I want to grow old, but I want to be fit. I don't want to be dependent on somebody. I don't want to be lying on a crutches or bed, somebody helping me in a wheelchair. Correct. So my main agenda is not to stay young, but to stay fit. Wow. That's the most important thing.
Wow.
And
Amazing.
then, like you said, emotionally also, you become, once you have gone through that pain, then the day-to-day nagging things, small things which create bitterness in us, those small problems which are seen as a big hurdles, which becomes a big thing in our life, which will distort our mood or make or lose our balance. These are all things have gone down.
Okay.
Means you say, okay, not that big. Not any problem doesn't look as big as it used to be.
Yeah.
So you trivialize these things, or you compare it with, okay, when I can do that. I mean, these things are all cakewalk.
Yeah. So, I mean, so now I want to come back to this whole topic which is around cancer itself. I mean, so it takes a very so when people speak about cancer as a disease, it's not only the person suffering, but the whole family also suffers along with them, right? It can be draining emotionally, financially, as well as physically for families. So so let's say if once a patient comes to you, I mean, and tells you that, and if that person is detected with cancer, no advice, because as you rightly mentioned that you are not in that person's shoe. But usually, what kind of things which a family should keep in mind when they have an ailing cancer patient in their family?
See, I've seen patients from far over, from UP, Bihar, coming up and staying on the streets in front of Tata because they don't want to waste money on staying. So there are lots of people who donate food in front of Tata. So they get food, and there are public toilets there, and they get a cardboard and sleep on the beds on the footpath, and then they attend the hospital. Not that they don't want to spend the money, but they want to spend the money on the treatment.
Treatment, yes.
Whatever less is the treatment. And then when the patient comes, the patient's father, mother, or some relative, all the earning members come. And financially they lose there, and they spend whatever savings they have, and then financially everything is disrupted. And normally the advice which we give is, if it is treatable, okay, get the treatment done. But if it is beyond cure, do not spend on things which are beyond your means. Like, there are many drugs which are newer drugs, biological therapy or immunotherapy. These are very, very costly drugs, which will prolong your life maybe 6 months, 1 year, 2 years. And then the person ultimately has to die. And once you give an option to the patient that, see, this is the cost of the treatment, they are ready to sell their whole farm. And then they'll sell it, and then they come and get the treatment. And once this person who have spent and has expired, the people who are left behind are left in the lurch. So they are the ones who are going to suffer their whole life. So what the most sincere advice we give is, if it is beyond redemption, we say, please do not get any kind of these costly treatments. It's not going to help you much. And then go back and take a palliative care. Palliative care is where they get medicines which will relieve them of the pain during the final journey.
Okay.
So that is a palliative care.
Okay. All right.
And sometimes there's a fine line between saying no future and then maybe here. So that's when we say, okay, take the treatment, because you can never predict. Some people ask what is the extent of life which we can expect, which we can foresee. You can never foresee. Sometimes the person's resilience and mental strength, everything will work towards their favor, and then whom we have given 6 months of time will live up till 1 year, 2 years without any treatment.
What is the biggest miracle you have seen in your medical journey till now?
Biggest miracle,
where it just was beyond comprehension that, I mean, how could this happen?
It's like, see, I mean, all those patients who get treated are actually miracles. The most encompassing thing about what I have seen is, in Tata, people come with a, like the belief, like how they go to the temple. They say, if I come here, we'll get the best of the treatment and we'll get cured. And then in Tata, there are various points where you can never miss. For example, if I miss something on radiology, I'll say, okay, there is no cancer. But some other places he gets caught, in the sense like that the disease gets caught and then he ultimately gets cured.
Sure.
It's a government hospital where thousands of patients come here, but everybody gets into the loop, and then somehow or the other, nobody gets unnoticed, in the sense like nobody has a missed cancer or something wrong diagnosis happening, everything. Somehow or the other, within this multiple OPDs and multiple treatment areas, they get their treatment due.
All right. But has it ever happened that you guys thought that a person will survive only for, let's say, next 6-9 months, but they survived for, let's say, 4-5 years types?
There's a old Sardarji, his wife got a breast cancer, and he's so old in the sense like maybe he was 80 years, 10 years back only. And it's very difficult. Difficulty in walking, talking. He not even able to speak Hindi. And then he comes along with his wife, and then they stay at the Gurudwara near this Parel Gurudwara. They stay there. And then when my wife was in Tata, she was there during the surgery, operated. And then still every time they come, they remember my wife. And then my wife said, see, I am not there in Tata. My husband is there in Tata. Please go and meet him. And they have the patient afterwards had recurrence treatment, but still the patient is surviving. And they all the time they come for annual checkup from Punjab till here, and they come here, no language, no means to survive, but still they are surviving.
Okay, all right. And so let's say, I mean, at what stage of cancer there is no hope at all?
See, normally stage 4 is the end stage. Abhi jaise ki in breast cancer, if the cancer has spread to the bones and liver and lung, they say it's end of the life. But people have been living with the treatment for maybe 5 years. I mean, I have known my one of my family friend whose mother is afflicted with cancer. She's on different kinds of treatment, and then once one chemotherapy stops working, they change it to other. But it will take financial toll will be there.
Okay.
But for example, if it is a gallbladder cancer or a stomach cancer, they are very bad. Pancreatic cancer, even Steve Jobs had got a pancreatic cancer. With whatever treatment you do, if it is stage 3 or 4 in pancreatic cancer, they will not survive beyond 2 years.
Okay.
So different body cancers, different.
Okay. But usually at stage 1 and 2, what is the chances of survival?
Very high. If at all, if it is a breast cancer, stage 1, 99% cure rate.
Okay, all right.
And then stomach cancer, gallbladder cancer, they are very good survival rates if it is very early stage.
Achha, all right.
So most of the cancer, colon cancer, rectum cancer, early stages have a very good cure rates.
Sure. And when patients come to you, I mean, usually what is the kind of ratio you guys would have seen that patients are coming at early stage or slightly late stage where it becomes difficult to
So
cure?
Tata being a referral center, so most of the patients either early stages will get treatment elsewhere.
Yeah.
Those who think, the doctors think that this is advanced stage which we will not be able to cure. So most of them we see are the advanced stages cancers, where the treatment outside will be very difficult.
Sure. And so let's say if in case, if I have to be proactive and see whether I have cancer or not, I personally do my full body checkup done twice a year now, right? And those are not cancer related things, but it's a comprehensive body checkup. What are the lead indicators within those checkups which I can see which can lead me to go a little more deep in terms of getting my body checkup for cancer?
Now, in the present scenario, there are no markers where you can say, okay, if this marker is high, you should get a cancer checkup, or there is a chance of cancer. So, like you said, whole body checkup once in a year, where you get an ultrasound abdomen and pelvis, and then chest X-ray once, and normal routine blood test, that should be fine. But the best indicator is to find the signs and symptoms. Rather than, you will not be able to predict it if it is not, the cancer is not there. But if it is there, for example, you have persistent cough. So you get a X-ray or CT scan of chest done. If you have persistent headache, not relieved by any painkillers, then you go to a specialist and say, okay, this is the. So neglecting any small signs and symptoms should not be done. So consulting your doctor rather than going by Google or having your own medication. So, for example, a patient with a breast cancer lump in the breast, so she should go to the breast specialist first, get an examination done, and then get the recommended test done, rather than doing the self-test done and then thinking that this is a cancer. Blood in stools, or blood in the vomiters, or intractable abdominal pain. These are the things which you should not neglect.
Understood. These days, so Dr. ChatGPT has also come in. पहले Google करते थे, अब ChatGPT.
So ChatGPT actually gives you a very good diagnosis. Only thing is, you should feed in the symptoms correctly. Correct. Unless you identify, for example, you can say, okay, abdominal pain. It will give you abdominal pain ka differential diagnosis of this thing. But if a doctor palpates and says that there is a pain in the right upper quadrant, then that's the site of gallbladder. Lower quadrant, it's the site of appendix. Then the left side, there is a sigmoid colon or descending colon. So different sites will have a different meanings of that one. And you have a change in bowel habits, constipation with diarrhea alternating. Then you have to get a colonoscopy done. Sure. These are the things which only the doctor can suggest you based on the symptoms. Sure.
Now there is a very big conspiracy theory which I'm sure doctors would hate to hear about, but there is a very big conspiracy theory which people keep talking about, the fact that in the world there is a cure for cancer already, but the medical fraternity is keeping it away because of the amount of money which is involved in the cancer industry. So how, I'm sure, these are all conspiracy theories, but has anybody come close to having any kind of early diagnosis or treatment for cancer yet?
I mean, this is a news for me. I haven't heard this conspiracy. Like you said, cancer cure, in the sense, vaccines are been invented for cervical cancer. So the HPV vaccine, which has significantly, drastically decreased the cervical cancer incidence in India. So that is one of the vaccines. But for other things, they have not come. Dr. Rajendra Badwe, he was the director of Tata Memorial Hospital so far. So what he continuously and constantly reminds us is, we are working towards our own oblivion. Means we are working. For example, we want to create a cure for cancer. Once the cancer is cured, then the Tata Memorial Hospital is closed. So we are always continuously striving towards our own oblivion. So that is our aim, that we want to be out of this. So we don't want the cancer to happen. So we continuously, the researches have been done, are being done to find a cure for cancer, but there's no reason to believe that there is a cure for cancer which is not being publicized or being marketed. So there is no truth in that one.
Yeah. What kind of technological advances have come in now which can help us maybe detect cancer early, or for that matter cure cancer? Has there been any technological advances?
So there have been liquid biopsy, which is like a sample of blood which you take and then try to find out the tumor markers or any cancer cells. That is not 100% proof, but if at all, if there are cancer circulating cells in the body, then that will identify. That means already the patient has a cancer which is being identified in the early stages. And then there is a PET scan, but that is also again only if you have a cancer in the body. There is no the technology which can say, okay, I'll screen you and say you will not get cancer for 10 years. There is nothing. It can only say at this point of time you have cancer or no cancer.
Okay, all right. Because right now, in the last season of Shark Tank, what I saw is that there is some DNA testing which is done in people's body, which can in advance tell you that what kind of diseases which can come to you and at what age kinds. Is that, is that DNA sequencing or whatever is possible? Is that also, how clinically, appropriate is this?
See, genomic sequencing is being done, but only for the already known cases of cancer where whether there is a particular gene being affected or not, and then whether he'll be suitable for a particular kind of chemotherapy or immunotherapy.
Yeah.
But maybe that will come in the future where you can say, okay, by identifying the gene sequence, we'll know that he has a probability of cancer. Like there is a gene mutation called BRCA in breast cancer. If the patient has a breast cancer and then the sibling or the offsprings, they get a BRCA test done, and if the BRCA gene mutation is positive in this one, then you can say, okay, the patient has a very high likelihood that they get a breast cancer or ovarian cancer. So they will be put on an intensive screening.
Sure.
So that, if at all, if you know that there is a gene mutation happening, and you will know that this cancer can happen. Like for colorectal cancer also there is a gene mutation, but you cannot do that in whole population and say, okay, these people have this mutation, so they should take care of. So it will not be viable in a financial terms or also in the extent of. So you can pinpoint one particular family saying that in this family there is this gene. So these offsprings and siblings can get a screening done.
Sure. Great. Thanks a lot for all the insightful things which you spoke about. I believe that I got a little scared, but yet, very, very aware of what we need to take care of. Any final thoughts from you in terms of what can we do as a society in order to avoid exposing ourselves to the risk of cancer? Any final thoughts over there?
There is always a label on the cigarettes that cigarette smoking is injurious to health, and then there is a picture of the cancer, and there is a gutka, there is a picture of that one. But the government doesn't have the courage to ban that one. You know that this is going to cause cancer, irrespective of how many persons, but it's going to cause cancer. And then it's freely available, everybody. If you see the taxi drivers, everybody, you can see everybody literally chewing on the pan. And I've seen so many oral cancers. It is one of the highest incidence of oral cancers in India. Nowhere in the world you have oral cancers except in India because of this particular affliction. So either the government has to ban it, or you say, okay, all the people who are eating, please get a medical checkup done and then give them free service. So awareness in those people is one of the most important thing. And then awareness, you cannot force people to stop once it's freely available. For example, now the drugs like heroin, cocaine is not available in the drug. So only few people have the access to it. So you make it inaccessible so that the general population who are poor do not get afflicted with that one. That is one of the most important thing. And then people who are aware, knowledgeable, literate people should have the awareness about what to do and what not to do, like lifestyle, stress, and having a healthy lifestyle and happy lifestyle. And then the family bonding, the bonding social network is very important. Not the social on the net.
Yeah.
So it is the interpersonal relations
Yeah.
which actually takes out the stress.
Yeah.
So people previously in the villages used to go to the chopal and sit under the tree and then discuss things,
Yeah.
talk to people. So that human bonding is also very important. So
Hmm.
emotionally you should be very stable. Emotional, the sharing of the burden that also helps us in having a happy life. So happiness is not something which can be acquired with wealth.
Yeah.
So the friends and then your society, everything plays a major role in our happy life. And then I think those are the things which we can have, which we have control.
Yeah.
And whether you get cancer or not is not in your control. If you get, and the only way is to get cure early.
Yeah.
Early detection is one of the most important thing in having a cancer-free life.
Yeah.
And then there is a stigma attached to the cancer. People are still afraid to say that I have cancer because people surrounding them look at them in a different ways. So they are normal people with a, like you get a fever, cold, cough, that some people get cancer and then they cured.
Yeah.
So that stigma should be removed, that the cancer patients are not something that they have not done something wrong.
Sure. Great. Thanks a lot, Dr. Suman. It was great interacting with you. I could have done 3-4 sessions around this, but would love to maybe have you again next time sometime.
Thank you. It was nice chatting with you. And then, I mean, I also never thought that I'll speak so much.
Thank you. Thanks for your time.
Yeah, okay.